Welcome back to our channel, where we explore the fascinating world of vaccines and their impact on public health. Today, we're diving into the topic of pertussis, more commonly known as whooping cough, and the importance of the pertussis vaccine. So, let's get started. What is pertussis? Pertussis, also known as whooping cough, is a highly contagious respiratory infection caused by the bacterium Bordetella pertussis. It primarily affects the respiratory tract and can cause severe coughing fits characterized by a distinctive, whooping, sound when the infected person tries to breathe in. Pertussis is most dangerous for infants and young children, but it can also affect teenagers and adults. The infection is transmitted through droplets when an infected person coughs or sneezes, making it easily spread in close quarters or crowded environments. Pertussis can lead to serious complications, especially in infants, including pneumonia, seizures, and even death. However, vaccination with the pertussis vaccine is an effective preventive measure to reduce the incidence and severity of this disease. What is pertussis vaccine? The pertussis vaccine is a vaccine that provides protection against pertussis, also known as whooping cough. It is typically administered as part of a combination vaccine called DTaP, diphtheria, tetanus, and acellular pertussis, for infants and children, or Tdap, tetanus, diphtheria, and acellular pertussis, for adolescents and adults. The pertussis vaccine contains antigens derived from the Bordetella pertussis bacterium, which stimulate the immune system to produce antibodies against the bacteria. These antibodies help the body recognize and fight off the pertussis infection, reducing the severity of symptoms and the risk of transmission. The pertussis vaccine is typically given in a series of doses to ensure optimal protection, with booster doses recommended for adolescents and adults to maintain immunity. Vaccination with the pertussis vaccine has played a significant role in reducing the incidence of pertussis and preventing complications associated with the disease. How pertussis vaccine is manufactured. The manufacturing process of the pertussis vaccine involves several steps to ensure its safety and efficacy. Here's a general overview of how the pertussis vaccine is manufactured. Selection of pertussis strains. Pertussis strains are carefully selected based on their ability to induce a strong immune response while maintaining safety. These strains are chosen to represent the most prevalent and virulent types of Bordetella pertussis bacteria. Growth of pertussis bacteria. The selected pertussis strains are cultured and grown in a laboratory setting under controlled conditions. The bacteria are grown in a medium that provides the necessary nutrients for their growth. Inactivation or purification. Depending on the type of pertussis vaccine being manufactured, the bacteria can be inactivated or purified. Inactivated vaccines contain killed bacteria, while acellular vaccines use purified components of the bacteria, such as proteins or surface antigens. Addition of other components. Other vaccine components, such as diphtheria and tetanus toxoids, may be added to create combination vaccines like DTaP or Tdap. These components provide protection against diphtheria and tetanus in addition to pertussis. Formulation. The purified or inactivated pertussis components, along with other vaccine components, are formulated into the final vaccine product. This may involve mixing, stabilizing agents, and adding preservatives to ensure the vaccine remains safe and effective during storage. Quality control. Throughout the manufacturing process, rigorous quality control measures are in place. These include testing the vaccine for purity, potency, and safety. The final vaccine undergoes thorough testing to ensure it meets regulatory standards and specifications. Packaging and distribution. Once the vaccine passes all quality control tests, regulatory approvals, it is packaged into vials, syringes, or other appropriate containers. The vaccines are then labeled and prepared for distribution to healthcare providers, clinics, and other vaccination sites. How pertussis vaccine work? The pertussis vaccine works by stimulating the immune system to recognize and mount a defense against the Bordetella pertussis bacterium, the causative agent of pertussis, whooping cough. Here's how the pertussis vaccine functions. Introduction of vaccine. The pertussis vaccine contains specific antigens derived from the pertussis bacterium. These antigens are typically proteins or toxoids that are either inactivated or purified to reduce the risk of causing disease. Common pertussis antigens used in vaccines include pertussis toxin, PT, filamentous hemagglutinin, FHA, pertactin, PRN, and Fimbriae, FIM. Immune response activation. When the pertussis vaccine is administered, the antigens in the vaccine are recognized by the immune system as foreign substances. This recognition triggers an immune response. Antibody production. B cells, a type of immune cell, are activated and produce antibodies specific to the pertussis antigens. These antibodies are proteins that bind to and neutralize the pertussis bacteria or their toxins, preventing them from causing infection or damage. Memory cell formation. Along with antibody production, the immune system generates memory B cells and memory T cells. These cells, remember, the specific pertussis antigens and provide long-term immunity. If the person is exposed to the actual pertussis bacteria in the future, the memory cells quickly mount a robust immune response, preventing or reducing the severity of the infection. Immune system protection. The presence of antibodies in memory cells provides protection against pertussis. Antibodies can neutralize the bacteria or toxins, while memory cells ensure a rapid response if re-exposure occurs, limiting the spread and severity of the infection. By inducing a specific immune response and generating memory cells, the pertussis vaccine helps prevent the development of pertussis or reduces its severity if infection occurs. Vaccination also plays a crucial role in reducing the overall transmission of pertussis in the community, protecting vulnerable populations such as infants who are too young to be fully vaccinated. Who require pertussis vaccination? Pertussis vaccination is recommended for various individuals across different age groups. Here are the general guidelines for pertussis vaccination. Infants and children. Pertussis vaccination is typically initiated in infancy as part of the routine childhood immunization schedule. The recommended vaccination schedule includes doses of the DTaP vaccine, which protects against diphtheria, tetanus, and pertussis. The first dose is usually given at 2 months of age, followed by additional doses at 4 months, 6 months, and a booster dose between 15 and 18 months of age. A 5th dose is recommended between 4 and 6 years of age. Adolescents. In order to maintain immunity, a booster dose of pertussis vaccine is recommended for adolescents. This is typically administered as the Tdap vaccine, which also protects against tetanus and diphtheria. The Tdap vaccine is usually given at 11 to 12 years of age, with catch-up vaccination for those who haven't received it yet. Adults. Pertussis vaccination is also recommended for certain adults, especially those who have close contact with infants or individuals at high risk of severe pertussis. This includes parents, grandparents, and caregivers of infants. Additionally, healthcare workers who may come into contact with pertussis patients are advised to receive the vaccine. The Tdap vaccine is recommended as a one-time dose for adults who have not previously received it. Pregnant women. Vaccination against pertussis is particularly important for pregnant women. The Tdap vaccine is recommended during each pregnancy, preferably between 27 and 36 weeks of gestation. By receiving the vaccine during pregnancy, mothers can pass on protective antibodies to their newborns, providing them with some immunity against pertussis until they are old enough to receive their own vaccinations. It's important to consult with healthcare professionals or refer to local immunization schedules for the most accurate and up-to-date information regarding pertussis vaccination requirements. Is there any AEFI associated with pertussis vaccination? While the pertussis vaccine is generally safe, as with any vaccine, there can be some adverse events following immunization, AEFI. Here are some AEFI associated with pertussis vaccination. Local reactions. The most common AEFI following pertussis vaccination are local reactions at the injection site. These can include redness, swelling, tenderness, or pain. These reactions are typically mild, temporary, and resolve on their own without any complications. Systemic reactions. Some individuals may experience systemic reactions after pertussis vaccination. These can include fever, irritability, drowsiness, loss of appetite, or general discomfort. These reactions are usually mild and short-lived. Severe allergic reactions. While extremely rare, severe allergic reactions, known as anaphylaxis, can occur following pertussis vaccination. Signs of anaphylaxis may include difficulty breathing, swelling of the face or throat, rapid heartbeat, dizziness, or hives. Immediate medical attention is required if anaphylaxis is suspected. It's important to emphasize that the occurrence of serious adverse events following pertussis vaccination is very rare. The benefits of pertussis vaccination in preventing whooping cough are more significant than the risks of AEFI. Healthcare professionals closely monitor individuals receiving vaccines and are prepared to manage any adverse reactions that may occur. Vaccine safety is continuously monitored through surveillance systems, and any new information regarding AEFI is taken into account for ongoing vaccine improvement. Conclusion. So, Let's spread the word about the power of the pertussis vaccine and ensure that more people are protected against whooping cough. Remember, vaccination is a key tool in safeguarding our communities and keeping ourselves healthy. Thank you all for watching. Don't forget to like, subscribe, and hit that notification bell to stay updated on our future videos. Stay healthy, stay informed, and until next time, take care.